no minimum age requirement for hormone treatments or mutilating surgeries for children who supposedly think they are not the sex that biologically they are and want to change it somehow. I mean, to describe it is to kind of highlight, I think the whole focus on having children do this is demonic, to be clear. Demonic. And I don't use that word lightly. We also sued, you know, one of the crazed, in my view, obsessions of the left here in the United States, medical authorities in other areas of the world are backing away from it, is transgender extremism, especially the mutilating surgeries that are performed to advance that agenda on children, or drugs hormone drugs given to children who believe they are a different sex to change their sex somehow. It's just Frankenstein-like experimentation on children. I think it's just terrible. And the fact that doctors do it and it's legal, to me, is a public policy problem. And outrageously, the Biden administration, the Biden-Harris administration, is obsessed with promoting it. And one of the key promoters of it is Rachel Levine, who was a senior official at the Department of Health and Human Services. She's Assistant Secretary there. And this person is a man who has undergone transgender treatments and now presents as a woman. I don't know what I'm allowed to say. I mean, because the left wants to destroy you if you misgender someone. So this person, Rachel Levine, is a transgender extremist. And I don't point it out because of the transgender nature of the person, but because of his policies. And we had asked for records about the promotion of these mutilating treatments targeting children and surgeries targeting children. And it looks like his office was involved in promoting that and pushing it. According to a June 2024 Alabama court filing, Levine feared that the World Professional Association for Transgender Health, which is a notorious transgender extremist organization, had draft guidelines that would make it difficult for American transgender youth to obtain access to procedures, including gender-changing surgery. So they had minimum ages for these people to engage: 14 for sex hormone treatment, 15 for chest masculinization surgery, cutting off the breasts of young girls, 16 for breast augmentation and facial surgery, and age 17 for essentially destroying the sex organs of children. And Rachel Levine's office objected to those minimum age standards, which are just an abomination as they were, but even that was too much for this craziness that's taken over our Homeland Security, our Health and Human Services Department. Psychologist James Cantor provided expert testimony on documents from that international group as part of this lawsuit challenging an Alabama law that restricted this mutilation of children and such. Cantor testified that Assistant Secretary Levine influenced the substantive content of the standards of care documents based on political goals rather than science. Specifically, Assistant Secretary Levine, through a staff member, pressured the entity to remove recommended minimum ages for medical transition treatments. In a communication provided to the court, an association member had written, Sarah Boateng, who is Admiral Levine's, she's an admiral, Rachel Levine is an admiral. The chief of staff for Levine said that the biggest concern is the section below in the adolescent chapter that lists specific minimum ages for treatment. She is confident, based on the rhetoric she is hearing in D.C. and from what we've already seen, that these specific listings of ages under 18 will result in devastating legislation for trans care. She wonders if the specific ages can be taken out. So they wanted to eliminate minimum ages for mutilating surgeries for minors. Did you vote for that? Did Congress authorize expenses in that regard? I don't think so. And she invoked, the chief of staff invoked Admiral Levine's name. She likes the standards of care very much, but she was very concerned that having ages, mainly for surgery, will affect access to health care for trans youth. This isn't health care. It's the opposite of it. According to a June 25th, 2024 report in the New York Times, they changed their mind. There were no minimum age requirements out of this document. Insanity. No minimum age requirement for hormone treatments or mutilating surgeries for children who supposedly think they are not the sex that biologically they are and want to change it somehow. I mean, to describe it is to kind of highlight, I think the whole focus on having children do this is demonic, to be clear. Demonic. And I don't use that word lightly. And this is your federal dollars at work, your tax dollars at work at the federal level. Biden-Harris appointee Levine, who abused power and is notorious for promoting transgender extremist policies, promoted mutilating surgeries for minors. It is no wonder the Biden-Harris administration wants to cover this up with unlawful secrecy. Judicial Watch's lawsuit to expose the truth is urgently needed to protect children. I mean, this is an emergency. We got to protect the kids from this transgender extremism. Thanks for watching. Don't forget to hit that subscribe button and like our video down below.